All right, so it's a little bit after 3, so we're going to go ahead and get started. The first thing that I want to do is just be able to share some of the ways that we can interact with each other. So we're going to be using the Q&A chat box feature that's listed to the right of the screen. So feel free to comment throughout and let us know if you have any specific questions or if you're having trouble hearing us or any technical difficulties. But we're going to be doing a Q&A session after the presentation. So when you pose your questions, make sure to include your affiliation and that contact information as well, so we know who we're speaking with. So before going into the content today, I did want to briefly go over the goals for all of us. So the first is to understand the implications of predictive analytics in building more equitable decision-making strategies in child welfare, to discuss the potential pitfalls of the use of predictive analytics, and to include you in the discussion to inform some of the best application of these tools moving forward. So we're very fortunate to have some of the most knowledgeable people on the subject in the audience today. So getting your feedback and building momentum is really some of the most valuable thing that we can get. And also, just as a PSA, moving forward, there's going to be a lot of alliterations and generally hard to pronounce words, so please be patient with me as I fumble around a little bit. But here is just a brief overview of what we're going to be getting to today. So for the folks that aren't familiar with the Kirwan Institute, I'm going to give just a short description of who we are and the work that we do. But most of today, we're going to talk about my white paper titled Foretelling the Future, and discussing the following 4 potential barriers to equity that predictive models might pose. And finally, we're going to close out with a discussion and Q&A with Daniel, who's going to lead that off, and also will be taking your questions as well at the end. So as an overview of the Kirwan Institute and our mission, we work to create a just and inclusive society where all people and communities have the opportunity to succeed. So our work centers in a lot of different domains of work, particularly education, criminal justice, public and community health, and civic engagement, to name a few. Beyond working in these different domains of opportunity, we also apply 2 specific lenses for looking at the barriers present to receiving opportunity. The first is structural racialization, and the second lens is race and cognition, and I'll describe both of those in more detail. So the cognitive barriers is really going to be the role of individual level thoughts and actions in maintaining structures of inequity. These are things like implicit bias, explicit bias, interpersonal interactions, and other social dynamics. Whereas on the other hand, the structural barriers have to do with the influence of history, policies, practices, and other institutional values that perpetuate inequity. So I'm going to give some more detailed examples throughout the presentation of those structural barriers. So combining these 2 lenses, we're going to apply them to the use of predictive analytics in child welfare. But just an overview for those that might not be as familiar with this term, predictive analytics has often been described as a way to predict the future using data from the past. There's ultimately no consensus on the exact use of these predictive analytic tools, but they do pose a lot of key characteristics. So first is their ability to sift through large data sets through a variety of either statistical analyses, algorithms, or machine learning, and they typically involve assigning levels of risk to various outcomes, although this isn't always the case. And they've been increasingly sought after to guide decision-making in child welfare fields. They've also been increasingly used in other domains such as in education and marketing as well. So although today's discussion will generally take more of a critical approach to the use of these tools, the general reception has been relatively positive for the reasons of their potential to help access hidden data patterns, to help streamline service delivery, and to decrease operational budgets. However, we're going to be talking about more of the cons, and this is the risk of perpetuating biases, those cognitive and structural dynamics that I described earlier. So generally, when we think of these characteristics of how predictive analytics models operate that we shared a few slides before, they fit in with this linear operation that includes large data inputs on one side and the decision-making outputs on the other side. Through these inputs and outputs, we've contextualized our framework at Kirwan for understanding the barriers that these tools might present for equitable service delivery, which leads us to our 4 main barriers that we've identified. The first is that humans may encode biases into the machines, previous marginalization as a predictor for future risk, overconfidence in the objectivity of outputs, and perpetuating existing structural disparities. So this is just going to guide our conversation moving forward, and the first aspect that we're going to focus on is humans encoding cognitive biases into machines. So I'm going to be using these slides as bookends for each of the sections, and they're all going to have a variety of quotes on them, but I did want to highlight that the first one and a couple others is by Kathy O'Neill, who's the author of Weapons of Math Destruction. So if you haven't had a chance to read that, I highly recommend it. So a lot of the support for predictive analytic tools is in direct response to the lack of objectivity inherent in human decision-making. So as evidence, Kirwan also publishes an annual implicit bias literature review, which is pictured to the right, titled The State of the Science. For the State of the Science, we catalog all of the best findings on implicit racial bias in research each year. And these findings reveal countless racial disparities in a variety of different settings. Here listed are some of the most prominent research on the subject. These are hiring decisions, evaluation of writing samples, and school discipline outcomes. The common thread that weaves all of these different studies together is they both include matched samples where only one piece of information is changed, which is the race of the person involved, which leads to very racially disparate outcomes, despite the fact that all other information is identical. So knowing that these findings are true and that it's been replicated over time, we think and we look to these predictive tools potentially as a remedy. However, humans are still able to encode our values, beliefs, and biases into these analytic tools by determining what data is used and for what purpose. So over the next few slides, we're going to do a quick thought exercise to illustrate the point of the values and beliefs that we're asking these tools to internalize. So for those that weren't with us at the beginning, I'll just give another 30 seconds or so to quickly grab a pen and paper. I'd really love if we're able to write some. And I also did want to add a caveat that the examples that we're going to be using are definitely overly simplified for the purpose of illustrating some of the more severe ends of the decision-making spectrum. So do please bear with me for the exercise. Okay. So on a scale of 1 to 5, with 1 being the lowest and 5 being the highest, please indicate what is the level of risk associated with each of these actions. So the first, option A, is a child is removed from a dangerous home situation and placed with a foster care family. For choice B, a child is wrongfully removed from a safe home and placed with a foster care family. So just write 1 to 5, the level of risk. So the next set of choices, we have option C, a child is not removed from a dangerous home situation and faces future maltreatment. And option D, a child is not removed from an otherwise safe home environment. So I'll give you all a few more seconds to write those down, and if anyone feels the need or if they want to, you can let me know in the chat box, but that's not required. But what I do want to know is, did it feel difficult or even wrong to quantify risk that way? Right, so it should feel very problematic to assign some of these finite quantitative ratings for such an important set of options to consider. So this type of characterization should feel a little bit uncomfortable, but this is exactly what we're implicitly asking these models to do. Assign numeric risk to a human condition. And to some extent, these initial value judgments that humans possess ultimately impact the scope and sensitivity of the tools that we're going to be using. this exercise is really meant to illustrate the two types of errors that people are often most citing when thinking about how they're used. So a type 1 error being the false positive, indicating risk where there really is none, which is reflected by option B. The other type of error, a false negative, or not indicating risk when there is a true risk present, was reflected by option C. Although there isn't a total consensus on which is more harmful, generally we believe false negatives are regarded as being more of a problem. But simply thinking that one type of error is worse than the other doesn't really take into account the frequency or the scope of the risk present. This is probably getting a little bit too far into the weeds here, but I did want to use this illustration to stress how our values are getting implicitly translated to the data that we use and how we interpret it. As such, let's reconsider options B and C. So again, these tools are going to inherit our values and the inclination to ascribe more risk to the potential of a false negative, which is option C. And yes, so option C, thank you for responding, Stephen. But this gets a lot more tricky, and maybe a lot of you posted that option C was the most risk, but it gets a lot more tricky when we think of the scope of values that we want these models to embody. So for example, it doesn't matter if there are 10 more cases of option B each year. What about 100? So these examples aren't meant to sway any of your opinions in one way or another, but just to demonstrate how, in the pursuit of trying to interrupt risk, these tools must also inherit some of our human definition of risk, one that may or may not accurately reflect the vast amount of nuances in this circumstance. So finally, when thinking about all of the values that these models may potentially embody, they're going to depend on the type of decision being made, and also other aspects of the context matter. So for example, as we just illustrated, how many children are impacted, and the accuracy of those predictions. For example, our value of risk can look much different if the predictive tool is helping to screen in or out a hotline phone call versus placement decisions. And we're going to touch on this specific example later on in the presentation. In internalizing our values, predictive models can also include elements of human error. So relying on human-entered data sources, particularly those with elements of subjective judgments, can create bias earlier in the inputs pipeline. These are especially through the means of archived data or field-level reports. So as a takeaway for this section, predictive models can inherit human values. This is most present in defining and accounting for risk. And predictive models can inherit human biases. And this depends on the data inputs that potentially include human bias and human error from earlier in the pipeline. Next, we're going to move on to another aspect of the inputs. And so far, much of the critical analyses of the use of predictive analytics has centered around this idea or this concern that they may internalize past marginalization. Of particular interest for our institute is demonstrating how neutral data is actually deeply entrenched within our history of racial segregation and inequity. As a practical way to illustrate this point, I'm going to briefly share some of Kirwan's opportunity mapping work. So on the right is an opportunity map of Franklin County, which is where Columbus is located. This opportunity map outlines opportunity on a scale where low opportunity is illustrated by light areas and high opportunity is illustrated by dark areas. So the indicators used for this opportunity index include housing and neighborhood dynamics, transportation and employment, health and safety, and education. So those that are not familiar with Columbus and looking at this map, areas of low opportunity are vastly overrepresented by communities of color, and particularly Columbus's Black residents. So this opportunity map can serve as a foundation for exploring a variety of other social and public health disparities as a function of geographic location. So for example, on the next couple slides, I'll show you some other Columbus maps which identify higher rates of public health concerns which follow very similar geographic patterns. Before moving on to those, I did want to briefly take the opportunity to acknowledge my colleagues David Norris and Mick Buck, who do a lot of the mapping work at Kirwan, as well as my colleague Glennon, who originally compiled some of these slides. So looking here at other maps indicating infant deaths and prison admission rates, we see that the hotspots are also in these areas of low opportunity that very similarly map onto this map as well. Also, the Senior Vulnerability Density Index and life expectancy also reveal that life expectancy itself is lower in areas where there's low opportunity. So when taken together, we see a story of spatial inequity that spans from the earliest to the latest walks of life. But also what we know is that these patterns originated from somewhere. So the next level of analyses that we're required to do is to see how our local policies and practices contributed to these spatial and social disparities. So added on the left is actually an image of an old Columbus redlining map. And areas in red and even yellow were those where loans and other housing opportunities were explicitly restricted and diverted away from communities of color. So visually we can see that opportunity in a variety of domains is largely mirroring these earlier maps. This means that much of the building blocks for our current social economic landscape was already being determined by these segregationist housing policies that were very common from the 40s through the early 60s. So by looking at these maps, the analysis begs the question, what does our zip code really say about us? In light of these pervasive spatial inequities resulting from explicitly discriminatory policies, it's easy to see the inherent challenges to equity by using place-specific data, even when it appears racially neutral at the surface. So while zip code is usually just thought of as a label indicating where someone lives, it contains information on systemic poverty, access to healthcare, and other community resources, and of course, patterns of legally endorsed discrimination. So these factors, of course, are outside of a child or family's conscious control, which means that using zip code as an indicator of risk or an input for other dimensions of these models demonstrates more problems than we may readily perceive at the surface. So by internalizing structural and historical risks, these models may pose the threat of overrepresenting people of color, particularly Black and Latino families, in those high-risk categories. As the last topic related to perpetuating structural marginalization, these tools do not have data readily available to counterbalance their inputs, meaning they can rely on incomplete information. So for example, here's an illustration of a factor that's been related to risk of maltreatment in the literature. So the number of children present in a household. A model could use this variable, the number of children, for filtering incoming records. And the model would likely reveal that children from a family with 4 or more other children is at higher risk for maltreatment. But what that means is that of the records available, having 4 or more children in the family presents more risk than families with 3 other children or less. More importantly, what this doesn't mean is that families with 4 or more children are predisposed toward maltreatment. And we certainly don't have data on all of the families with 4 or more children that never had any incidents of maltreatment. So in this way, risk is not only relative to the limited inputs that are available, they don't reflect the larger population. This means that models are predicting risks from incomplete data sets. And of course, we can't and don't want to keep records of every child in America, but this is just to illustrate how we might presume that ratings of risk are absolute, but in reality, they're not. So as a takeaway, we want to show that seemingly neutral data can act as a proxy for social categories. The use of social spatial data cannot be removed from a history of racially discriminatory policies. Black and Latino families in particular might be overrepresented in high-risk classifications, and these tools do not include the correct or adequate data to counterbalance for decision-making. Next, we're going to briefly touch on the overconfidence and objectivity associated with these predictive outputs. So to harken back some of our work that I talked about earlier on implicit bias, the literature suggests that professions where there's an overarching expectation to be objective and fair, like in the legal system, for example, the implicit biases can actually be the most pervasive. So if we're overconfident in the objectivity of our decision making, we're actually less likely to consider the notion that our decisions may adversely affect others. And this allows biases to go unchecked. So the first step in ensuring accountability is then acknowledging the potential for error or bias. In the same vein, as we've already discussed, the data used in these models, at least in part, reflect some of the same biases and idiosyncrasies in humans' decision-making patterns. Just because we quantify something doesn't make it objective reality. So if we accept that these tools are objective at face value, we may not include an appropriate amount of safeguards or accountability mechanisms to ensure their equitable application. So just as a quick takeaway, there may be false security in the use of big data and other big data tools like predictive analytics. And just as we create safeguards for human decision making, we need to stress the accountability in the use of predictive analytics to inform decisions. As our last main point, we're going to talk about how predictive analytics can perpetuate existing structural disparities. So in the event that these models do internalize those cognitive and structural biases within the inputs that we've shared, and proper accountability isn't built into their use, we might quickly run into the possibility that predictive analytics can further exacerbate structural disparities. So the perpetuation of these disparities mostly relies on the level of intervention that these models have in a child's life and the scope and frequency of their use. So this goes back to some of the original questions and discussions of what type of tools and what type of decisions these tools are being used to inform. So again, let's consider the example of using this as a screening tool for a child abuse reporting hotline. First off, I worked at a call center before, and no one was ever this happy. Predictive analytics, as a way to help screen hotline calls, has received much more support compared to the support of their use in placement decisions. Of course, the rationale is that with the initial contact of a screening, the risk inherent with making an error or perpetuating bias isn't nearly as high as it is with the possibility of wrongly removing or failing to remove a child in a placement decision. However, I'm going to be using a couple examples to illustrate that this is also a value judgment, and we should have a critical analysis of whether this is true or not. So again, consider having to weigh the potential type 1 and type 2 errors. There are risks associated with both, and it should also be noted that even though using predictive analytics is less invasive than in a placement decision, there's always a risk of maltreatment. So to illustrate, if there's a false positive, this could happen with a field agent following up to assess risk more thoroughly. At worst, the risk is additional monitoring by child welfare when it's not warranted, could present family stress, be a misuse of resources, and encourage distrust for the system. Whereas on the other hand, an agent will be delayed in following up or not follow up because that call wasn't screened in. So therefore, they might not reach out to that family unless a second report is filed. So in this case, maltreatment can still occur. Now consider, in light of those risks, adding the additional weight of internalizing the biases that we've discussed earlier. For example, if zip code is used as an indicator for these predictions, the model, we might see systemic racial disparities in the likelihood of receiving these errors. So typically, again, we think that by internalizing the structural and historic risks, people of color, particularly Black and Latino families, might be overrepresented in high-risk categories. So not only does this create the possibility of falsely imposing scrutiny of families where true risk is not present, but it redirects resources by attending to false risk when other cases should actually be screened in. So these decisions, because of their extreme importance for families and children, are likely to spill over into other social well-being outcomes. And the likelihood of perpetuating systemic bias is even more robust when we also consider the fact that there's hundreds to thousands of calls being screened in or out every single day. So for the sheer volume and possibility of perpetuating bias, the use of predictive analytics tools that report hotlines should receive just as much protection and accountability as they would for use in placement decisions. So finally, as takeaways, the scope and level of intervention should both be considered for the potential perpetuation of structural disparities. And bias or negative outcomes have the potential to increase barriers to opportunity in other areas of life. And these could be additional financial, health, or just emotional hardships associated with these judgments and decisions. So there are a lot of other general concerns with the use of predictive analytics in child welfare, and these center around knowing how accurate they are and whether they truly promote better decision making. However, I wanted to focus on one concern in particular, the possibility that these tools can lead users to fall into the trap of confusing correlation with causation. So these are charts from a Spurious Correlations blog, which I find very funny. The first one is looking at the correlation between divorce rates in Maine and the per capita consumption of margarine. And the second one is letters in the winning word of the National Spelling Bee and the number of people killed by venomous spiders. So despite the fact that we see that both of these are highly correlated over the period of a decade, there's actually no causal influence. Maybe we could argue the case that consumption of margarine somehow relates to divorce. But yes, in seriousness, we can see that one of them does not lead or contribute to the other. So we see similar patterns and a similar frame of thinking for the use of risk factors to predict maltreatment. So first consider prior CPS involvement. This correlation is very high and it's often considered the best predictor of future maltreatment. So knowing that this data is incredibly valuable for those that are using these tools, but although it's highly correlated, this type of risk assessment is not without its problems. So for example, like the prior charts, it's pretty easy to see that the involvement with child services is not causal for enhancing the risk of maltreatment. Similarly, another potential indicator, the receipt of public benefit, is not causing increased risk of maltreatment. It's likely that a third confounding variable, such as poverty, may increase both of these factors. However, when we look at some of the other factors that have been highlighted by these models, such as single parenthood or parent arrest record, there's almost an implicit attribution of causality, that these home dynamics actually create an environment that's more harmful or dangerous to the child. But in reality, we don't hold these factors to the same level of scrutiny as the others, and we don't know if these or other risk factors revealed by predictive models actually contribute to the family welfare outcomes in a meaningful causal way. So we might be thinking to ourselves, well, if they're highly correlated, why does this matter? But identifying risk factors with no causal link creates huge problems if we think of trying to take steps to engage in preventative solutions through public policy or other mechanisms. So predictive tools can only reveal the past, not more beneficial solutions for breaking the cycle moving forward. So as our final takeaways, before transitioning into the Q&A, predictive models can internalize human biases through what data we use and for what purpose. Previous marginalization may serve as a proxy for future risk, and overconfidence in objectivity can limit accountability and accuracy. Unchecked cognitive and structural bias in predictive analytics use can potentially perpetuate long-standing inequities, and non-causal information cannot help develop new reform efforts. So as we close out, I did want to briefly highlight what's next. So on my paper available on the Kirwan website, again, I included several steps that I think would be very beneficial moving forward. So these are developing a code of ethics, increasing accountability, assessing equity impact, and broadening the scope to focus more on resource allocation versus risk assessment. So I don't want to go too far into these because I really want to use this discussion to help generate more solutions through the help of you all. especially since this is still a very new topic. And I think that there's many stones left unturned that would benefit from having your all's multiple perspectives. So with that, I wanted to turn it over to Daniel, who's going to lead our discussion.
Thank you, Kelly. Thanks for the opportunity to hear your white paper and get your perspective on implicit bias, structural bias, and how that affects or could potentially affect the application of predictive analytics in child welfare. I wanted to, and questions are starting to come in, so I'll get through mine because I want to hear from other folks. But given that implicit bias is so prevalent, as you showed, with the studies coming through that the Kirwan Institute is tracking, and that implicit bias has been noted to potentially change the way systems interact with people, could it be possible that predictive analytics is a good buffer to implicit bias? So, without it, you're more subjected to implicit bias.
Sure, I think that's a great question. So I would say that certainly predictive analytics and other big data applications have the potential to mitigate many of the problems associated with implicit bias or affinity bias or any of the other problems with human decision making. However, this benefit also relies on the assumption that the data going into these models is free from those implicit and structural biases, which of course I argued that it's not the case. And there's also a lot of new interesting research on implicit bias and artificial intelligence that suggests this might never be the case. So a study came out from Princeton this year that's actually going to be featured in our next iteration of the State of the Science, but they looked at a linguistic-based artificial intelligence program, and they found that the program actually replicated some of the same race and gender associations found in the seminal implicit bias literature. So they did so by looking at the relationships between words and their context. So for example, if the word doctor was consistently found used in a context closer to the word man than woman, it would suggest a gender bias for that particular word. So that's the that's the tool that they were using in a specific study. But as a result of their findings, the authors asserted that any artificial intelligence that relies on language to learn will inevitably internalize some of these implicit and explicit biases that are present in our culture. So if bias is inherent in our language, even a completely neutral machine will eventually learn enough to have those biased associations. So using these as a way to potentially mitigate or eradicate those implicit biases kind of remains to be seen. But this is why focusing on those structural manifestations and outcomes of these tools is so important as a way to kind of counter the effects of cognitive bias.
Well, I wonder, because there is also in your paper, there's a discussion of that it would be hard for users essentially to counter the tool. So if a predictive analytics tool said that there was a high risk situation, they would be loath to disregard that information and not move forward with a more punitive response to that case that they've been presented with. And the current tool for measuring risk that's pretty predominantly used, structured decision making, or any other actuarial risk tools that are out there for child abuse investigators and child welfare workers, are often overridden or can be overridden by the workers themselves. And so, what is the danger really, and why can't it be seen just as a tool that's not going to drive decision making so much? Why did you think that was important to include in your paper, that you think it'll be hard for people to disregard?
Sure, and I think that that's a really excellent question, and already some folks in the comments are asking kind of similar things. So I'll answer this by first looking at some of the distinctions, again, between the structured decision-making model in child welfare and predictive analytics tools. So first, like you said, the actuarial risk assessment in structured decision-making. This is part of a larger process of interacting with the family. It includes conducting site visits and reassessing the level of risk at different times. But as of right now, it remains unclear whether predictive analytic tools will be housed in a process of similar checks and balances, or even be incorporated within a structured decision-making framework, or whether they'll be more of an independent form of accounting for risk. So I'd say that many of the criticism for the lack of accountability surrounding predictive analytics could certainly be appeased if it were a part of a more comprehensive model. But that being said, a predictive tool is definitely a different animal than an actuarial tool. In structured decision making, field workers are on site. They have access to the questions used to make these risk categorizations, so they know what the inputs are. Whereas, again, predictive models might incorporate more archive data or a larger body of field reports that on-site workers may not readily have access to. So it's the difference between assessing whether certain risk factors are present versus trying to predict those outcomes for similarly situated families. The access to the information is not identical in those cases. So both of these are not without their potential pitfalls, and I kind of alluded to some of those dynamics in my presentation. But as it stands, I would say that structured decision making appears to offer more accountability and oversight as it currently is. But this might not always be the case moving forward, depending on what types of accountability mechanisms are built in.
So I'll just jump to John Kelly's question, and John Kelly happens to be a senior editor with the Chronicle of Social Change, and he asks, do you think that existing actuarial tools, so SDM for example, suffer from the same type of biases and deficits that predictive tools do? And to the degree, do you think you answered that fully, or do you want to elaborate on that?
Sure. Yeah, I definitely I believe that any use of human data certainly internalizes some extent of bias. But I definitely don't think that, as both of these tools are right now, that the scale or the degree is the same. Again, because of those kind of protective mechanisms built in, and also the fear of having black box algorithms where field agents actually won't know what types of inputs are going into those models to determine risk, and therefore they won't have an opportunity to counter what those judgments are. Whereas using the actuarial risk tools, they can kind of rely on some more of their personal judgment.
Okay, and one thing you talk about is about creating some kind of code of ethics moving forward. This is something that Catherine Elliott, who's just popped up with a question, asked about too. So I'll ask my question and then jump to Catherine's question in more detail. But you mentioned this idea of creating a code of ethics, and I'm curious about what that would look like. But I'm also wondering, on the scale of points of entry into intervention and utilization of any kind of tool, whether actuarial or predictive analytics, where you see the least amount of potential problems in terms of bias or just problems, period. So, for example, like, would it be in a child abuse prevention context, like at birth, at the hotline? You talked about placement decisions. I know that that the Duke Endowment is working with SAS on a project that deals with families after their children are involved in the system. So I'm just wondering, before we get to code of ethics, is there a better, if you're going to start somewhere, is there somewhere that you think is less ethically confounding?
Sure, I think that's a really good question. I think, I guess in figuring out where in the pipeline would be the best fit, it really is going to be contingent on that specific system, but just being able to make sure that there is an appropriate feedback mechanism. So things that looking at the use of them at birth, that can definitely pose problems in terms of if they're used to categorize risk, and the potential barriers and constraints that we're putting on a small child. But if it's used for allocation of service delivery, that's going to look very different. Similar with the screenings and phone calls, that might be one of the easier places to quickly evaluate whether these screening tools were accurate in their prediction. So I'd say initially, I don't think that that's a bad place to start just to make sure that there is that appropriate feedback put in. But as we know, there's a lot of other system constraints that are posed by people in child welfare. So I think that the biggest concern is that the use of these tools will be adopted, and we're not making sure that there's those safeguards and those evaluation practices in place to catch children that may potentially fall into the cracks.
Okay, so Catherine Elliott is asking, what examples of strategies to ensure accountability? What are some strategies that you see?
Sure. Again, just making sure that there is some evaluation mechanism. Are we keeping track of those outcomes? Do we know that the predictive analytics tools are better at predicting those outcomes than field agents? Right now, we really don't have that corresponding field data. So I think that that is probably the most important step early on. Also ensuring things like black box algorithms and other tools that take the autonomy away from field level workers that are actually interacting and seeing the children and the families. I think that there's also a potential danger for that. And as we're talking about accountability, I think there's, and ethics within this conversation, I think that there's a lot of legal folks that are having their eyes on whether they have the potential to perpetuate those disparities that we talked about. So I think that just really tracking those outcomes over time and making sure there isn't a disparate impact as well.
And so if you're thinking about this code of ethics that you talk about, what are some of the tenets that you'd want in there?
Sure. So before getting into the tenets, I think that right now the question of who should develop these code of ethics is equally important. So I think that making sure that programmers and computer scientists are at the table, but they're also interacting with child welfare field workers and community stakeholders to inform some of the decisions that they use so they can get the appropriate feedback on making sure that they're taking the perspective of the things that people that are actually on the ground are encountering. But as a baseline, again, for those ethical and legal implications, I think at least at this early stage, they're certainly going to center around that ensuring these tools don't create a disparate impact for communities of color. I imagine that there's going to be a lot more work in the future to assess the impact of how these tools are applied, as I talked about. But right now that I think that the most ethical approach would be ensuring that race and racial proxies have minimal likelihood of being used in these models and shouldn't be used to define risk. Already, I think it was Pittsburgh wrestled with the possibility of including race of the father in their predictive models. Ultimately, it was decided against, but I think that the field as a whole should really address the potential for situations like that happening early on, instead of waiting to rely on a potential legal case to address the use of racial information in these predictive analytic tools.
So you'd counsel against using race as a potential risk factor included into the algorithm?
Absolutely.
And then zip code as well, correct?
Yes, absolutely.
Okay, and so but then you mentioned something else in your report that there was this idea of going broader in scope. So I'd really love you to elaborate on that, because a lot of times we're talking about individual cases. Mm-hmm. And so I was just wondering if you had given more thought to what that actually means, being broader in scope in the kind of delivery of services and response to heightened risk.
Sure. So this is something that the Institute cares a lot about. So hopefully some of the folks out there could appreciate the irony of talking about doing opportunity mapping that relies on kind of the same types of information that these predictive models use. So the only difference is that it acts as a mechanism for understanding where opportunity is located as a means of determining intervention points, and isn't used as a tool to weed in or weed out families necessarily for service delivery. So I think that making sure that risk isn't necessarily associated with where someone lives or what someone looks like and making sure that these aren't acting as a gatekeeping mechanism being the most important. However, I don't think that these tools do a bad job at all of just assessing the landscape and being able to identify patterns that we might not be able to look at on these individual one-to-one decisions.
Okay, we got a question from Nate V. If race ends up encoded in pretty much every variable, does it actually help to keep an explicit race variable out of a model?
Well, yes. So I guess in terms of being able to counterbalance the use of race in these tools, it's been suggested by some folks that explicitly including race, but not as a risk factor, but as a potential looking at the confounding variables has definitely been suggested, which I'm definitely not opposed to. I think that ignoring race and trying to be more colorblind with the use of these tools is definitely not and has historically not been the best method of moving forward to making sure that our policies and practices are racially equitable. So I think that, yes, if we are looking at race, to have it as an explicit variable, but not as, again, a gatekeeping mechanism, but just to make sure that what the data reveals is that we're on the right path.
Catherine Elliott is again asking, many people think that if a predictive model is effective in predicting an outcome, it is a good model. They forget to take into account that the outcome itself is biased. How do we ensure that this mistake is not perpetuated?
I think about that one for a sec. So I think that's really kind of where the impetus for including confusing correlation with causation, or where I was starting to think about that discussion. Of course, looking at CPS involvement in these cases is the best predictor, but we know that in no way does CPS cause some of those things. And I think that it's important to look at other factors and other risks that these models highlight and have as critical as a perspective for those as well. And I think that, as Catherine might be suggesting, that there is kind of this overall sentiment that accuracy is the most important part of these models. Whereas I think that the ability to perpetuate those structural disparities has an even greater risk, especially, again, at the sheer scale and the use of these. We have to make sure that there is at least a safety net that if we're doing thousands of screening calls on a daily basis, do we know whether they're going to be systematically affecting one race or one gender or one group worse than the other? We have to definitely take that into account.
Kelly, in doing this white paper, did you have a chance to really look around the country at different examples of where predictive analytics in child welfare is taking root? I mean, there's not that much out there yet, but you mentioned Pittsburgh. Having at other places, what California's up to, what SAS has been doing in Florida, and now up in New Hanover County in North Carolina. Have you been taking a look at that stuff, and is there something that sticks out to you as being the most kind of ethically guided thus far?
Sure. So I think that the first area that I was looking at is those cases down in Florida. Not necessarily that they were doing potentially the best job, but that it kind of piqued my interest because they were looking at such a very finite data set, and this was what was really highlighting the need to get that counterbalancing information, is that they were looking at predicting the instances of child death in their counties, but they were really working with a data set that was below 10 children, I think, at the time that they decided that was going to be a policy consideration that they were making. So this was a really interesting dynamic, again, to address Catherine's question of, even though these models might accurately identify risk, what is the scope of the problem and how many instances of people are we really leaving out? Having a data set of 10 or less isn't a good use of these predictive tools. However, I do think that there's been a lot of more robust discussion around the equitable concerns of these tools elsewhere. I haven't seen too much of the SAS right now, but yes. So if you have information on that, I'm sure both I and the folks attending here would like to know.
Wonderful. And I just have a question is, it seems that these predictive analytics tool in the child welfare context can point to need, whether that's on a individual level or as you're arguing for trying to do it on a more broad level, more community level. And I just wonder what you think are the potential positive policy implications or negative policy implications on big policy decisions that are focused on this. Does this help kind of bolster the argument of your opportunity mapping in the sense that it shows places where you need to invest more?
Oh, yes, absolutely. I mean, as I said, I think that the data that's being revealed by these models is actually really important and is really necessary for policymakers and government officials to have access to, similar to the opportunity mapping. It's really that gatekeeping mechanism for weeding in and weeding out children where some of the critical analysis needs to take place. But as a tool for revealing these things, I think that it just reiterates some of the things that we've known so far about the impact of systemic poverty having all of these adverse spilling over effects. And I think that these tools are one of the many comprehensive analyses that we've used to look at those multi-tiered effects of poverty, but it's just another way to reveal to policymakers where some of the hotspots might be, and what is some of the depth of the depth of the concern that some of these communities are facing as a way to potentially intervene.
Right. So okay. So we're coming up towards the end of the hour. So we got a question from another participant that I'm gonna give to you, and then I'm gonna let you close out, Kelly. So you can answer this question and then and wrap up. So this is from Sarah Williamson from Case Commons. Is there anyone that you know of developing predictive analytics tools transparently rather than keeping the algorithms in a black box? What are your thoughts on communicating inputs to end users versus agency leaders, policymakers only?
Sure. Thanks, Sarah. I think that's a really good question. So also, again, in Pittsburgh, even though the use of that racial identifier was posed, they were ultimately deciding on the inputs with a group of stakeholders. One of the criteria was looking at the accuracy of these tools and also kind of thinking of whether this is something that folks that were using these ultimately wanted to be included. So even though there were definitely some contention around those meetings and around the inputs that were uplifted, they were definitely doing so in a context that was more inclusive of some of the voices that might be impacted. Whereas in a lot of places, these tools are offered by private companies and will be determine the use with agency officials or those in leadership roles without necessarily even getting that input or buy-in from the people that are going to be most affected. But that's definitely not always the case, and there is people out there getting that community input.
Can I jump in real quick? Just on that note, is in California, the California Department of Social Services is working with the Children's Data Network out of USC School of Social Work, and they are doing it in a very, as they describe, glass box fashion. So they are making all of those inputs as the process moves forward. They'll make all of those inputs available, and so I think that's something to look to your point, Sarah, about an opportunity to get buy-in from circles broader than just the policymakers and the practitioners.
Mm-hmm. Definitely. Okay. Any more questions?
Nate V says thanks. Thank you, Nate.
Thank you, Nate. I'm glad you're here.
um, well, Kelly, I think the hour's coming to a close. So from my end at Fostering Media Connections, where we work every day to try to tackle some of the bigger issues in the field of child welfare, broadly described through our 3 publications, A Chronicle of Social Change, Fostering Families Today, and Adoption Today. I'm just very happy to have been able to spend this hour with you discussing an issue that we've covered intensively, something that we're going to be continuing to be covering, and something that we're very interested in. So thank you, Kelly, for putting this all together.
Great, and thank you so much for hosting me, and thank you all for being here, and I really hope that this general discussion can really start to ignite movement forward as some of these tools start being used and applied in the future. So if anyone does want to connect with Daniel or I, please feel free to leave your contact information in the comments, and I'll definitely get back to you.
Thank you so much.
All right. Well, thank you all for being here.